Top 10 signs of idiopathic intracranial hypertension. Don't miss these red flags. Talking about a clinical case scenario, a 25-year-old medical student suddenly develops severe daily headaches, number one, and starts losing her peripheral vision. This will be your clinical case scenario for your NEET PG and USMLE exams. Doctors thought it's just stress, but it's actually a condition that could make her permanently blind. By blind, you can remember the complications, about which I'll be talking to the subsequent slides. First of all, we need to identify the condition. This is known as idiopathic intracranial hypertension. After that, there is a primary master mnemonic which I have designed for your easy memorization and learning, that is characterized by headache. Intracranial hypertension, everyone will have headache, right? Headache VP. Imagine the vice president of a company is having headache. Headache VP. There is no space here, so what I'll do is I'll write P somewhere else. Fine, headaches. First of all, headaches, these are severe, they occur daily, and they are bilateral. Fine. After that, in the eyes there is a problem. Extremely important sign, never ignore it. That is papilledema, or swelling of optic disc swelling. After that, A stands for auditory, characteristic pulsatile tinnitus. Fine. Then we'll be moving on to D. D stands for diplopia. This is double vision. This is occurring from sixth nerve. What is the name of the sixth cranial nerve? Please tell me in the comment section. I know you will answer. Know it. I'm not naming it because now I want answers. After that, aching neck and shoulders. Aching neck and shoulders. Moving on with cognitive changes. Cognitive changes. These can be depicted as brain fog and memory issues. Then we can move on to hypersensitivity to light and sound. Hypersensitivity to light and sound. Also, E stands for episodes of transient visual loss. Then, last but not the least, vice president. I left space so that I can write it here. Visual field effects. Visual field effects. It can cause peripheral vision loss. Peripheral vision loss, and also P stands for projectile vomiting and nausea. Projectile vomiting and nausea. Okay, so this is the main mnemonic. After this, we will be starting. Okay, projectile vomiting and nausea. Then musical rhyme mnemonic. Let us sing it out now. When pressure builds up in the head so high, 10 warning signs you can't deny. Headaches daily, vision blurred, pulsing sounds in ears are heard. Double vision, neck pain too. Brain fog makes thinking hard to do. Light hurts eyes, sounds make you wince. Blind spots growing ever since. Vomiting comes with morning light. Papilledema, the doctor's sight. By this, you can remember all of these with a simple song. Then talking about the demographic specific mnemonic. Young women. Young women. So how? Y will stand for number of years. 18 to 44 years age group is the most commonly affected. Then obesity is the strongest risk factor for this. 71 to 94% of cases. Then U stands for unilateral or bilateral headaches. N stands for nausea and vomiting. And G stands for gradual vision loss. Gradual vision loss. Young women. Pretty woman. Dekho dekho na, pretty woman. Then, pretty women. Young women are pretty, right? Yes, they are. Even when they are old, then also they are pretty. Women are always beautiful. Women, 85% of cases. By this you can remember, in women 85%. That much common it is in women. Then optic disc swelling, also characterized by papilledema, that is a doctor's finding. M is morning headaches worse. Morning's headaches worse. Episode of visual blackout. Episode of visual blackouts. And N stands for neck pain and stiffness. Then there is an emergency red flag mnemonic. Emergency red flag mnemonic is Vision SOS. Vision SOS. SOS is an emergency call. All of you know that. Visual field cuts. Visual field cuts. That is peripheral vision loss. Peripheral vision loss. Then increased headache severity. I, increased headache severity. S is swollen optic disc. Then I is intermittent visual blackouts. O is obesity in young women. N is nausea with projectile vomiting. S, sixth nerve palsy. Come on, name the sixth cranial nerve leading to diplopia. O is opening pressure. Opening pressure more than 250 millimeter of water. And S is sounds pulsating in ears. Then moving on to what is the pharmacology connection. First line treatment is acetazolamide. Now here also there is an easy way to memorize the spelling. First the spelling, you know, carbonic anhydrase inhibitor. This is the medicine which this inhibits this. Know it, right? Acetazolamide. It is a first line treatment. C, you can remember the mechanism of action, carbonic anhydrase inhibitor. Then E stands for elevated or increased CSF pressure reduction. Elevated CSF pressure reduction. T, treatment prevents blindness. Avoids permanent vision loss. Z stands for zero structural brain lesions on MRI. You can't notice this on an MRI. That is the main problem. Now, quick exam mnemonic. You have to give an exam. USMLE and NEET PG exam I also gave, and that is like hell. I'm in hell. I am literally inside hell. I'm in hell. That is how much hellish kind of headache you have. I, increased intracranial pressure. M, morning headaches. I, idiopathic, no known cause. That is majority of the medical diseases are idiopathic. They have no known cause. But we have evidence-based medicine. N is normal brain MRI. H is headaches daily. Headaches, immediately the body responds. Any pressure increase, headaches daily. E is eyes show. Yes, very good. Papilledema. L stands for loss of peripheral vision. And if you do an LP or a lumbar puncture, you get a pressure of more than 250 millimeter of water. There is a clinical triad mnemonic to further emphasize, can be remembered by HVP. Headaches, severe, and they occur daily. V, visual symptoms, field effects, papilledema. Again, P stands for both papilledema and it is a pathognomonic sign. You know what is a pathognomonic sign, right? Then moving on to the diagnostic criteria. Dandy's criteria we use, Dandy 4. All these 4 criteria must be met for diagnosis. Documented papilledema, absent, A is for absent, absent focal neurological signs. N is normal brain imaging, MRI is normal. Documented elevated CSF pressure. Young obese women typically. Then talking about the treatment ladder, you need to slim down. I'm not talking about reducing weight here, but an easy way to memorize the treatment ladder mnemonic. First of all, what you need to do is slim down. S is surgery. This occurs if medical treatment fails. L is yes, you have to lose weight. So losing weight should be the cardinal thing that will make it easy. Inhibit carbonic anhydrase by giving acetazolamide. Monitor vision regularly. Blindness is one thing we are really afraid about. D is, I have already told you, diuretics, acetazolamide. O is optic nerve fenestration. Then W is weight loss counseling. N is no delay in treatment. No delay in treatment. And complication which I told you at the start that I'll be telling you, it can make you blind. Bilateral vision loss possible. Long-term disability if left untreated. Irreversible visual field effects. Needs immediate intervention. And again, reiterating the fact, don't delay treatment. Don't delay treatment. Okay. That is all you need to know.